So if we look at the blood supply to the pancreas and the spleen, again we need to look at the celiac trunk. We can see the celiac trunk is giving rise to a whole series of blood vessels. It gives rise to a big branch that runs along the posterior aspect of the pancreas towards the spleen, and that's the splenic artery. Coming off the splenic artery, we have some small branches that supply the body and tail and neck of the pancreas. But importantly, at the head region, we have what are known as pancreatico-duodenal arteries. So here we can see pancreatico-duodenal arteries. They supply the pancreas and the duodenum. We have a superior pancreatico-duodenal artery, and that comes from the celiac trunk by way of various branches like the gastroduodenal. And that has superior pancreatico-duodenal artery, has anterior and posterior branches, which we can see running on the anterior and the posterior surface of the pancreas and the duodenum. Coming from the superior mesenteric artery, we also have inferior pancreatico-duodenal arteries, and these themselves have anterior and posterior branches, which supply the anterior and posterior surface of the duodenum and the pancreas. We'll explore these in more detail when we look at the arterial supply to the gastrointestinal tract in a later lecture.